Greetings. Let us talk about pre-cleaning of an endoscope. And irrespective of what endoscope you use or the company that you use, it is a good idea to follow the manufacturer's instructions for use. It's about following the protocol set by the manufacturer. In this video, I'm going to share with you broad principles that are applicable to almost all scopes that are currently in use in 2020. So once you complete the endoscopy, the next step is to turn off the lamp, and after that you should immediately do the pre-cleaning. I want to stress that you should immediately start the pre-cleaning process so as to prevent the bioburden and the biofilm from developing. Say for example, you are scheduled to assist a patient's double procedure, EGD and colonoscopy, and once EGD is done, before you go for the colonoscopy, you should take time and do the pre-cleaning of that EGD scope immediately instead of waiting until both procedures are done. This will lead to a lot of biofilm formation. The proteinaceous material will dry up and it will be hard to really clean it out. And that biofilm will keep on developing with each cycle of cleaning, and the bacteria get stuck in there, and that will be a source for infection. So what is required for pre-cleaning? You need an enzymatic detergent. It is like soap, like a detergent. It gets rid of all the proteinaceous and fatty material. You need a cleaning sponge, and you need an air-water channel irrigation valve. So, and then you also need a clock to time the different steps of the procedure. The first step is take a sponge, immerse it in the detergent, and wipe the insertion tube from the top down, one way, top down. And once you clean the insertion tube, you could discard that soiled sponge. And then the next step is put your scope into that enzymatic detergent and press the suction button and suction for at least 30 seconds. And you should literally time your suction for 30 seconds. That's how you get rid of all the burden that is in the suction channel. If you are using a side viewing ERCP scope or an EUS scope that has an elevator, you should move the elevator up and down, up and down, up and down as you do the suction, so as to get rid of any debris behind that elevator channel. So you have taken care of the suction channel. Then the next step is the air-water channel. So how do you take care of that? You apply the air-water channel irrigation valve and press the button down, and this will force a lot of water down the air-water channel, and you should do that for at least 30 seconds. And after 30 seconds of flushing water through the air-water channel, you release your release the button, take your finger off, and leave it there for 10 seconds to blow air through the air-water channel. So 30 seconds of water flush, 10 seconds of air flush. After you have done that, you go back and suction the remaining amount of detergent that is left in the bag. If you have an auxiliary water jet connector, don't disconnect that and use the tubing to flush water first and then air through the tubing to dry that air water, the auxiliary water jet tubing. Next, you want to remove all the buttons and valves, the suction valve, air water channel, irrigation valve, and the biopsy port cap. Then you disconnect all the tubings that are connected to the endoscope, the suction tubing, air water button tubing, and then auxiliary water jet. You disconnect them, and then we have actually talked about how to disconnect, in what sequence and when. And then you remove the scope and you put the scope in a nicely coiled manner. Don't overcoil in the container. And you also put in there any reusable valves in there, and then the air water channel irrigation valve as well. It's important to note down the date and the time of the pre-cleaning done, and you place a lid, and once you are ready to take it out, take off your PPE, do hand hygiene, and then take it from the endoscopy suite to the scope cleaning area. In the scope cleaning area, there is usually a rack to hold all the soil scopes close to the door. Leave it there, and then remove your gloves before you get out. When you look at the bedside cleaning, there are a few errors, and these errors could have a great impact. If you forget to wipe the exterior, or if you forget to suction the channels, or if you forget to flush the channels, it leads to drying up of microbial burden in the endoscope. And when there is lower microbial clearance from the endoscope, it leads to infection to patients. And if there is a lot of stuff still stuck in the channels, and when somebody is cleaning them in the cleaning sink, it could pose a risk to the tech that is cleaning that scope. So it is very important to do pre-cleaning immediately after the scope comes out of the patient, and do not forget about the 3 important steps: wipe the exterior, suction the channels, and flush the channels. Thank you.